This came off the back of a NERC project called Veracqua, which was about environmental microbiology and human health program. At the end of that project was when the COVID-19 pandemic was just starting, and we knew that that would be likely to be traceable in wastewater. As soon as the first planes came into the UK with people being evacuated from China, we started monitoring wastewater, and we started monitoring the amount of SARS-CoV-2, the infectious agent that causes COVID, and we can use that to basically track how many COVID-19 cases there are in the community.
We collect domestic wastewater from municipal wastewater treatment plants 5 times a week from 47 sites. So this is a passive, unbiased way to collect data on illnesses and outbreaks within communities.
So through 47 samples, for example, in Wales, we can capture 70% of the population. You could never do that with individual testing, and it works out to be about 30p per person per year. So it's a really cheap and cost-effective way of doing public health surveillance. The money originally came from NERC to fund this project, and using NERC funding, we tested the methods, showed that we could monitor viruses in wastewater really easily, then approached the UK government and said this is a new surveillance tool, and they said we can see the potential in this, and then we rolled that out across England, Scotland, Wales, Northern Ireland, and particularly in the use case in Wales where we're based, the data was used to prevent 2 lockdowns. So we were going to head into lockdowns in 2021 and 2022 in Wales at Christmas period. Obviously that is not good for the economy.
Without doubt, the work that Davey and his colleagues and collaborators have led in Wales was world leading. We used this intelligence to inform our risk assessments, which in turn informed risk management policies and ministerial decisions about COVID-19 in Wales, helping us use evidence to reduce harm and act proportionately to the challenges we faced.
NERC funding was the catalyst for this whole programme. Without them, we would be nowhere. We started off with 3 people. We have now 27 people here based in Bangor University. We also have a centre based at Cardiff University, which hosts another 8 people. And then we have a data centre in London, which has another 10 people. And we've also used NERC funding to open up doors and do the same type of work in other countries like South Africa and Nigeria.
We also test quantitatively for enteroviruses, influenza viruses, RSV and noroviruses. And we also do sequencing for poliovirus.
You know, it really is so powerful in terms of disease surveillance, and the idea is that these surveillance systems in the future will be turned on all the time, constantly looking to the horizon to see which things are entering the country and which might make us sick.